Every year, over 1.4 million men around the world are diagnosed with prostate cancer. And in the US alone, it's estimated that more than 280,000 new cases will be diagnosed this year. That makes prostate cancer one of the most common cancers among men globally. But here's the twist: despite being so widespread, prostate cancer is also one of the most misunderstood diseases out there. For many men, it grows so slowly that they may never even experience symptoms or need treatment. Yet for others, it can be aggressive and life-threatening. So how do we catch it early? And should every man get screened? Let's start with the basics. The prostate is a small gland located below the bladder and above the rectum. Its main job? Producing fluid that helps carry sperm during ejaculation. Here's the kicker: while many men are diagnosed with prostate cancer, most don't actually die from it. Because prostate cancer often grows so slowly that many men pass away from other causes before the cancer ever becomes a problem. But when it is aggressive, catching it early can make all the difference. So who's most at risk? Age. Your risk skyrockets after age 50. In fact, prostate cancer is rarely found in younger men. Ethnic background. African American men are not only more likely to develop prostate cancer but also more likely to die from it compared to white or Hispanic men. Family history. If your dad or brother had prostate cancer, your chances go up too. Interestingly, if female relatives in your family carry the BRCA gene linked to breast cancer, you might also be at higher risk. Diet. Eating lots of animal fats or skimping on veggies could increase your risk. Now, let's talk about screening. There are two key methods. 1. PSA test. This stands for prostate-specific antigen. It's a simple blood test that measures a protein produced by the prostate. A high PSA level might indicate cancer, but hold on. Other things like infections, an enlarged prostate, or even riding a bike can raise PSA levels. So if your doctor says your PSA is elevated, don't panic yet. They'll likely repeat the test after some time. Sometimes, doctors recommend a DRE alongside the PSA test. During this quick exam, the doctor feels the prostate through the rectum to check for any abnormalities. But studies haven't shown that this alone is super effective at catching cancer early. If your PSA test comes back positive, remember, it doesn't automatically mean you have cancer. Non-cancerous conditions, like an enlarged prostate, are far more common. Your doctor may suggest repeating the test or treating you for a possible infection first. If the PSA stays high, they might recommend a biopsy. A biopsy involves taking tiny samples of tissue from the prostate using a needle guided by ultrasound. While it sounds intimidating, it's usually done right in the office. Afterward, you might feel sore or notice blood in your urine or semen for a few days. Here's where things get tricky. There are strong arguments both for and against prostate cancer screening. Let's weigh them out. Arguments for screening. Studies show that men who get screened with PSA tests may have a slightly lower chance of dying from prostate cancer. Early detection gives you the best shot at curing aggressive cancers. 5-year survival rates are much better when cancer is caught early. Arguments against screening. Not all prostate cancers need treatment, they grow so slowly that they won't cause harm. Many men end up getting unnecessary treatments with side effects like erectile dysfunction or urinary problems. Some studies didn't find any significant benefit to screening. For example, one large European study found that men who had PSA testing had a 20% lower chance of dying from prostate cancer after 9 years. Sounds great, right? But here's the catch: only one man in every 1,400 benefited from PSA testing during that time. Plus, 75% of men with abnormal PSAs who underwent biopsies didn't actually have cancer. So, who should consider screening? Most guidelines recommend starting around age 50. However, men with risk factors, like being African American or having a family history, might start earlier, at 40 or 45. Once you begin, screenings typically happen every 2 to 4 years, involving a PSA blood test. On the flip side, screening isn't recommended for men over 75 or those with serious health issues. In these cases, the risks outweigh the benefits. As for prevention, there are a couple of strategies to consider, but again, it's all about balancing risks and rewards. Supplements, things like vitamin E and selenium, were once thought to help, but research hasn't supported their use. Medications, drugs like finasteride, Proscar, or dutasteride, Avodart, can reduce the risk of prostate cancer by about 25%. However, they come with potential side effects like reduced sexual function or possibly increasing the risk of aggressive cancers. Plus, if you take one of these meds, your PSA levels will naturally drop, so keep that in mind when interpreting test results. And there you have it, a comprehensive look at prostate cancer screening. Have honest conversations with your healthcare provider about what's right for you. Stay proactive about your health, and thank you for watching. Don't forget to like, share, and subscribe for more videos like this.